A visit to your local barbershop may get you more than just a haircut.
Yeah, Gail's down in Inglewood today previewing the Black Barbershop Health Outreach Program. Kudos for them for making men pay attention to their health, Gail.
Exactly. Shave and a checkup in addition to a haircut. This is an event that will happen Saturday, and what you see going on right now is probably the way this barbershop and more than 100 others will look. In addition to the shave and the haircut, there's free testing, 3 free tests. If you weren't with us last hour, you're looking at one of the tests that will be administered to check diabetes, according to Dr. Bill Relaford of the Relaford Institute. And this is Wi-Fi.
Yes, it is. This
blood
is
sugar
a wireless
testing.
blood meter. We can check your blood sugar, and I would get a text message or an email if something is out of range. So we're very happy to bring this resource to this area of the country. Blood sugar and diabetes is a major problem in our community.
Now let us show you another test. I have never seen this before. We're here with John Campbell of Vasamed, as well as Dr. Stan Frencher, surgeon, UCLA, and we have a patient because now this tests blood circulation?
Exactly. This is a device called the Sensolase, and with it we assess blood flow right down to the foot level. We use a little laser probe. It sends a light signal just below the surface of the skin. Then we take a cuff and we place that over that laser probe. And just as though we were taking a normal blood pressure reading, we're looking at capillary flow down to the foot level. That value is very indicative of whether or not an individual has peripheral arterial disease. Here's a test. It takes about 4 minutes to do. This is one we just completed. This is a graph showing this person's perfusion, skin perfusion pressure.
How's he doing?
Well, he did great because what we have done here is we've occluded his flow down to the tissue level. We're looking for red blood cell movement. Then we're releasing the cuff pressure. And the point in which the blood flow returns to that tissue level is indicative of peripheral arterial disease. In this case, his SPP, or skin perfusion pressure, was 84 millimeters of mercury. That's a normal value. Okay. Somebody with peripheral arterial disease would have a much lower skin perfusion pressure number, and somebody that should be involved with a healthcare professional.
And speaking of healthcare professional, Dr. Frencher, this sort of tests for this PAD, we've seen commercials for this where they say, oh, you know, the circulation's not good in my feet. It really is a real disease.
Yeah, no, it's really important for men to recognize that peripheral artery disease is a disease that affects all the circulature. So everything can be affected, including your heart. It puts you at risk for a stroke. It puts you at risk for lower extremity amputation, and also puts you at risk for erectile dysfunction. So, I mean, it's important for men to recognize that although we're just testing the lower extremities, that it can impact your entire body.
You know, I made a face about the ED you mentioned, but seriously, you're doing this in conjunction with the other testing because diabetes complicates everything.
Exactly, and so amongst diabetics out there, there's about a third of Americans who don't know that they have diabetes, and diabetes is in direct connection with peripheral artery disease, stroke, heart attack, and diabetes puts you at higher risk. So screening for all of these problems helps us to identify men who need to be tested.
Yes, ma'am.
Well, and I think it also is important to say you can survive it and you can live with diabetes now when it is treated carefully. Should we talk about that as well?
Yes, Michaela's saying it's also important to understand, even if you're diagnosed, you can live with diabetes as long as you treat it and get the medication.
Diet and exercise is the major way that you treat or manage diabetes. Healthy diet, daily exercise.
Medication?
Medication if you need it. Sometimes people do need to have medication, either insulin or the pill, or just manage it with diet and exercise alone.
But I think what's important, though, is that for men that we're able to reach in the barbershops, is that ultimately we get them connected with the physician.
Sure.
Is that, you know, when we identify men here in the barbershop, you know, we're able to refer them to providers that they can then have a more in-depth conversation and other further testing that they need.
All right, real quick, that didn't hurt, did it?
Not at all, and I can date now.
Okay, he can date now.
He can date now?
All right, let's
How'd
get
he
some info.
figure that?
Well, you know, the doctor said something about ED, so I guess, okay. All right, let's give you some information.
Okay, gotcha.
There is a book about diet. Okay, stay with me here. There is a book about, he was worried. There is a book about diet. Dr. Relaford, it's your book, 5 Colors to Better Health.
5 Colors to Better Health, your guide to being fit, focused, faithful, and financially secure.
All right, our 1 o'clock special will tell you what those 5 colors are. And the event will be this Saturday, so we're warning you early, not warning you, guys, get on the bandwagon. One of the 100 barbershops, our location today, the new Millennium Barbershop, and when you go to the website and what had phone numbers, you get all of the locations.
And ladies,
I'm sorry about him, y'all.
And ladies,
thank you for your help this morning. That's interesting.
Go ahead.
Ladies, leave the guys alone. Let me go to the barbershop and take care of this.
That's what I'm gonna say, ladies. Nag your husbands, nag your boyfriends, nag your brothers and your fathers to get down there and do it.
Yes,
and they don't like going to the doctor.
No, they don't. And I think Gail had a casting call and filled that shop with handsome men this morning.
That's the way
That
Gail
couldn't
rolls.
have been random.